So we're going to go ahead and start back up again, if people want to settle in. Great, so we're going to pick back up with the treatment results report. So I will hand it over to you guys.
Okay, Todd again. Brian is my partner in crime on this one as well, so he'll help answer any questions you might have. The second in the series of 3 reports we did for the Senate Help Committee on treatment programs had to do with treatment program results. So here we looked at 2 things primarily. What are the measures that PEPFAR and OGAC use to measure the results of the treatment programs it supports, and then also looking at support that PEPFAR provides to partner countries to improve their monitoring and evaluation systems. So for the first objective, just looking at what are the measures that OGAC and PEPFAR use. This is defined by OGAC and in the guidance that it put out in 2010, which sort of laid out for PEPFAR and for the country teams and for everybody involved, what the key indicators would be across all of PEPFAR. And so those 3 key indicators are number of people on treatment directly supported by PEPFAR. Another important one, of course, is coverage, treatment coverage. And the third one is treatment retention, and that one in particular was added in 2010. So that'll come up in a little bit as we talk about the data that are available on treatment retention. So Jane covered a little bit, in her presentation, sort of information that's available on number of people directly supported by PEPFAR on treatment. So I don't really need to say much about this. We know the 5.1 million number. You see the graph. It tells the story. So, in early days of PEPFAR, very few people on treatment, and now by 2012, quite a lot of people. 5.1 million as of end of 2012. And as you can see in the graph there, the top line would represent all people on treatment in low and middle income countries, and then the bottom line with the shaded area is PEPFAR. What PEPFAR estimates to be its direct contribution to that number of people. And it's about, it's been consistently about half over this time period. So that's a really important contribution that PEPFAR makes in these countries. Oh, and I guess it's noted here as well, and mentioned earlier, that for all of the years, and IOM report mentions this as well, that the number of people on treatment PEPFAR has always exceeded its annual targets. So, we're doing our work, we are conducting our work in the middle of, sort of the shift that's going on in PEPFAR, and Jane mentioned this as well, which is a shift, maybe a little bit away from direct treatment provision in certain countries, and toward providing technical assistance and other support to help partner countries really build up and expand their own programs. And so you see this expansion in a number of countries that happens by local service providers, increasing their uptake in some of the countries. You also see where there's transfer of patients from PEPFAR-supported, sites and facilities and networks to maybe more local sites. So. You see in the earlier slide, how this results in greater number of people on treatment. We traveled to 3 countries, as Jim mentioned, Uganda, South Africa, and Kenya, and I think each of those 3 countries was really nice to give us a sense for the various stages that any given country can be in sort of going through this shift away from direct treatment provision and toward more technical assistance. In the past, in a country like Uganda, you could imagine that, PEPFAR's annual results were more or less equivalent to the national results because of the huge contribution that PEPFAR is making in that country. But then maybe that's less the case, again, as PEPFAR goes forward. And so we really thought quite a lot about, and talked with OGAC quite a lot about, how does PEPFAR measure its contributions to national treatment programs as this shift is taking place. And so the emphasis that we made in this finding and the recommendation, which you'll see on a later slide, is what measure can be used to basically kind of estimate that contribution. And the PEPFAR treatment indicator, as currently defined, doesn't tell that whole story. And so the idea is that OGAC could have some additional thinking around how to do this. So the second measure that I mentioned is treatment coverage. Now these data we reported UNAIDS data in our report, which were the most timely and up-to-date data. The data are reported by country teams to OGAC on an annual basis, and they kind of get some data from ministries of health. They look at some PEPFAR data, but again, sort of the most comprehensive and the most timely for us for the purposes of this report was the UNAIDS data coming out of the most recent annual report. And so here you sort of see an array of PEPFAR countries where PEPFAR provides direct treatment services. And on the right-hand side there, you can see that there's 8 countries where coverage rates are higher than 80%. For all of the countries in this table, you look at data from 2010 and you see increasing coverage rates. So greater numbers of people on treatment, the result here then is higher coverage rates. IOM's report mentions that, and Jane mentioned it earlier. The third key measure for treatment programs for PEPFAR is treatment retention. And as I mentioned, OGAC added this indicator to the guidance in 2010. So for countries where PEPFAR provides treatment services directly, the PEPFAR country teams report on this indicator. So there's about 3 years of data. We looked at the 2011 and 2012 data. And the 2012 data that came out right actually toward the end of our review, and we were able to kind of work with OGAC on assessing the data and finding ways to report on it appropriately in our report. So when we looked through that, we found that there were 10 countries where the 10 country teams that reported retention rates at or above 80%. This is retention data for facilities where PEPFAR implementing partners provide direct treatment services. There were 3 PEPFAR country teams that weren't able or did not provide data on this indicator. One of those had the figure for the numerator, but not the denominator, so we didn't count that one actually. So we were able to, again, array this. So there's a table in the report that shows, the number of countries that are at 8% or higher. We did, however, note some weaknesses in the data, and these were weaknesses that I think OGAC, in its analysis and in reviewing the data that the country teams submit as well, had identified. One is just, not complete data. So obviously there were 3 countries that didn't have complete data, but even the countries that did report on this one, there might not have been all sites reporting, all implementing partners. And then, when we read the narratives that accompany the annual performance reports, you see that the country teams themselves had some reservations about the quality of the data. So as far as, we didn't make a recommendation on this one because we noted that OGAC is taking steps to help country teams improve the data, for example, by providing technical assistance, sending out advisors, and things like that. So, but we were glad and proud to be able to put this information out there and using this data from the APRs, and then we're encouraged that the steps that OGAC was taking will generate more improvements as time goes on. Another key aspect of treatment programs, and one that's emphasized in the Leadership Act and one that's emphasized in OGAC and PEPFAR guidance, is on quality of treatment programs. And so to help assure and improve quality in countries, PEPFAR country teams and their implementing partners are providing a range of technical assistance, training and support and other activities to help improve quality. So then when you have implementing partners that are doing these quality assurance sort of technical assistance and other types of interventions, they're reporting to USAID and CDC on sort of what are their outputs and what are their outcomes. And that's where we saw in those quarterly reports a broad range of indicators that are used to report on quality and quality assurance. And the devil can be in the details, as anyone knows with indicators. And so, you have examples that we provide in the report. One was, for example, good clinical outcomes. Well, what that means actually, and how that measure then is, utilized by any, implementing partner, that can vary. So the number of appointments that are kept versus the number of appointments that are missed. There were some variations of how the implementing partners did that. So back in that 2010 guidance, OGAC had indicated that additional measures for assessing quality would be forthcoming. As of the time of our report, that wasn't there, and so we called on OGAC to provide that guidance to the country teams. And I think, again, it was at a recent IOM event that there was a discussion of a quality assurance strategy that PEPFAR is working on and developing broadly, and that strategy would include some indicators, some guidance on indicators for quality assurance. So we're, again, encouraged by that. The second objective, as I mentioned earlier, had to do with monitoring and evaluation systems and the support that PEPFAR provides to partner countries to improve their own systems. We did our field work. We saw these activities in all countries and in all levels of the health system. So you have the picture here that shows, that it's also for paper-based systems, for electronic systems, and again, this is helping partner countries, at facility level, at district level, and at national level, collect, aggregate, and report out information on treatment programs. Our main source of information for kind of getting a nice summary of what these activities are, again, were the country operational plans, annual performance reports, as well as evaluations. And it's when in looking at those documents that we saw that there are, as everyone knows, but there are certain weaknesses that remain in partner countries' M&E systems. Two key weaknesses that we noted in the report had to do with incomplete and untimely data. And there was also the issue of data not being used for decision making, either at the facility level or at the district level. PEPFAR guidance to country teams instructs them to start to integrate PEPFAR M&E systems with country M&E systems. There's a long history of PEPFAR having systems created specifically for PEPFAR reporting. That would be the data that the country teams provide up to OGAC and that ends up in the annual report to Congress, for example. But as there's a greater emphasis on country ownership, try to integrate those systems. So what we looked at was, what would be the standards that the data generated by partner countries' M&E systems ought to meet, for example, related to timeliness and completeness, so that the country teams know, okay, maybe it's time to actually start using data from these systems for PEPFAR purposes, PEPFAR reporting purposes. Those standards would be used to assess the readiness, and then, and maybe eventually you could say that a country's systems are strong enough, and you would sign on to them, and I don't know, maybe you get rid of the PEPFAR parallel systems. I don't know. So that was just like I said, looking at the M&E systems. Here's our list of recommendations. There were 3 of them for this particular review. The first one having to do with the method for estimating contributions to partner country treatment programs. The second one having to do with quality assurance indicators. And the third one having to do with standards for M&E system data. I'll leave it at that, and we can have a little time for question and answer.